look around and see a lot of the people that I know, and I think the importance of this opening isn't lost upon any of us. Many of us remember the first presence of the Indian Health Service here in Eufaula when they rented a little rickety storefront downtown Eufaula many years ago. And then we subsequently were able to have a clinic built just up on the hill here. And people were so proud of that clinic when it was built. And it's only 5,000 square feet. And we're standing in front of the new Indian Health Center that's over 70,000 square feet. So I'm very pleased to be a part of the ceremony today and seeing this open, not for the progress that we've made, but the progress that's leading to us providing you better service. And so it makes me very proud that you're here today, and we hope that we do our best every day to take care of you.
We're so proud to have a facility like this to help provide best health care to our citizens that they deserve. A little history about this as well is that when we were small children, my brother, my sister, and I, my mom worked at the clinic in Eufaula. She was an LPN. So we grew up knowing the staff real close, and the docs and all the nurses, and we actually learned how to take blood pressure. So it actually taught us a lot of things, and so we're very, very proud of the facility. We walked through, actually Daryl Proctor and I walked through last Friday, and to see the size of the building that's going to take care of our citizens is amazing. The room for our staff is amazing. I couldn't believe the comparison of, as Chief said, from 5,000 square foot to over 70,000 square foot. You could put it 10 times in here, and it will really better our citizens' health care. This will also better the care and create jobs in this area that we need, and our town, our citizens are very, very proud to have it, so we thank you very, very much.
This isn't an effort that happens with 1 or 5 or 10 or 15. This literally takes hundreds of people doing hundreds of things to accomplish this. So to all of you, we couldn't even begin to recognize that, but we are truly grateful for the roles that anyone has played in developing this facility. If you've ever stepped foot inside the old Eufaula facility, you will, whether you were a patient or a staff, you felt the strain from the lack of space and services that was in this facility. When I got here, we literally had plywood holding up some of the over some of the windows. It was just truly inadequate in every single way. Also, the Principal Chief hosted a planning event for our communities in Glenpool last year, and one of the first things that was told to us that the community was fed up. We didn't have the stability of our medical staff and the doctors and coming and going and leaving. So we know that this is going to be one of the absolute first steps that we're going to have to take to begin to stabilize this community's health care, and we're excited about that. As the Chief mentioned, this new facility is a joint venture. What that means is that the Indian Health Service and Muscogee Creek Nation, they go into a joint planning effort to figure out how to build the building to this size, who's going to pay for the building, and which Creek Nation usually puts the facility money up, and then Indian Health Service comes behind us and helps us with the operations of this. So this is a true partnership, and it's really a testament to when you work together what you can accomplish there. So once again, thank you for that. But today and after this ribbon cutting is really where the hard work begins. And I'm going to speak just a little bit to the staff, and the challenge is that we have to deliver greater access to health care in this community, and the staff, you're going to be responsible for that, and you have to hit those, you have to keep that in mind. We have to deliver high quality care. So to the medical staff, we have to watch how we do this. And the quality is just as important as having access. And we have to do this with compassion and humility. So to all of that, once again, thank you for being here today.
With greatly expanded space for staffing, this new health center will contribute to better health and wellness for the Muscogee Creek communities. The new 73,000 square foot facility will replace the old 5,000 square foot health center. I want to say that again because that's pretty remarkable. The new 73,000 square foot facility will replace the old 5,000 square foot health center. That is truly incredible. The Eufaula Indian Health Center will provide primary care, contract health services, dental care, radiology, women's health clinic, a laboratory, a pharmacy, and a diabetes prevention program and clinic. The views of the exterior help bring the outside indoors and create a pleasant environment for employees and patients. The tribe's connection with the natural environment is expressed through the exterior courtyards and areas of reflection, while an interior courtyard acts as a focal point and wayfinding device for patients waiting in the main lobby. The Eufaula Indian Health Center demonstrates our commitment to our American Indian families, and I'm so proud of what we've all accomplished today in collaboration with all of you. The IHS Joint Venture Construction Program has strengthened and partnerships with tribes across the country and ensured that comprehensive, culturally acceptable health services are accessible and available to American Indians and Alaska Natives. The mission of Indian Health Service is one that I take very seriously, which is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. I believe this new facility will support the work to achieve this important mission. The IHS looks forward to the continued partnership with tribes as we work to promote the healthy lives of all our members. I can assure you that IHS remains committed to creating a culture of quality, leadership, and accountability in partnership with tribes to provide the best patient care. On behalf of the Indian Health Service, I want to say Mado again for inviting me to share in this special occasion, and congratulations.
I can remember as a young man growing up, my father had this favorite saying he would say to me. We'd be out at the lake and we'd be in the boat. He'd say, jump in the boat. Well, if you fall out and hit your head, we'll go to the clinic. I'd be on a rock, we'd be jumping into the lake. He'd say, well, if you've hit your head, we'll go to the clinic. And I think what that tells us is that these programs, these facilities, the healthcare systems to American Indians in Oklahoma are a fabric of the family. And they are a fabric of where we live, why we live places, what we do, that there's not a day that doesn't go by where there's some discussion about health and the health of the family and the services and the things that you provide here in these clinics. They truly are a fabric of our communities and our families. And so I'm excited today to see this facility to be completed, and excited as a member of the Indian Health Service to be able to continue to advocate for and provide the staffing dollars and operation dollars as we move forward with this program. On behalf of the Director of Field Operations for the Indian Health Service, Kevin Meeks, I'm honored to be here with you to celebrate this occasion. And I would like to thank the Muscogee Creek Nation for allowing the Oklahoma City Area Indian Health Service to celebrate this day and partner with them. While you've heard Secretary Terry and you've heard Chief Floyd speak about the partnership of the program, we're glad to partner, but I want to make sure that it's very clear and make no question about it. Without the Muscogee Creek Nation's sovereignty, their leadership, their vision, their commitment, and overall operational capacity, we would not be celebrating today. Truly, they are the leaders in this joint venture and what you see standing behind us today. So, on behalf of the Indian Health Service to the Muscogee Creek Nation, thank you very much. We appreciate being involved in this partnership. Would like to also thank the Oklahoma City Area IHS staff for their ongoing support of this project as well.
We've had staff make sure that this was a priority within the Oklahoma City area office, and will continue to be a priority for this program and this facility as we move through the partnership with you over the years. Just because the facility is built and ready to go doesn't mean that our partnership ends there, and we will continue to partner in any way we possibly can. What we're really celebrating today is that we now see the shape of the future of the medical home for tens of thousands of patients. And I want to emphasize the word home. Because since 1974, when the Eufaula Indian Health Center was built, this has been a place that's truly been a home for a lot of patients. So we know within the facility, across the road, and in town, and this new facility today, it's a place where young couples were told they were going to have a child and that they were pregnant. It's a place where babies were brought in for their first appointments. It's a place where care is given. It's a place where we've cried with our community. It's a place where we've laughed with our patients. It's a place where we have mended broken bones, a place where we have given good and bad news to patients. It's a place of hope for the sick, and a place of physical, mental, spiritual, and social healing for our elders. A place where patients have come from all over to feel welcomed and have been given outstanding quality care in a safe environment. And while a home is a place where you live, a home is a place where you also feel you belong. And this place and these facilities are truly home for many of us, because at the end of the day, the new and expanded Muscogee Creek Nation Eufaula Indian Health Center on 500 Eunice Burns Road in Eufaula, if they haven't renamed the road yet, I'm not sure, welcomes us without judgment, regardless of resources. It will now welcome even more American Indians and Alaska Natives without barriers, and provide the citizens of the Muscogee Creek Nation and many others even better and expanded types of care. We now have an over 73,000 square foot facility in comparison to the small facility we discussed earlier. I've got 6,100, but those are probably government numbers. It could have been 5. But this beautiful facility will provide us a place of healing like no other before it in this and the surrounding communities. So on behalf of the Indian Health Service, I would like to thank the Muscogee Creek Nation again for their unwavering commitment to this project and leadership, which is demonstrated here today by celebrating this milestone and this finished construction.
It has services ranging from primary care, dental, physical therapy, nursing, behavioral health. We have a state-of-the-art fitness center, pharmacy. So it's going to be a very comprehensive place for our citizens and patients to go and get really state-of-the-art care in state-of-the-art facilities. We're going to have the majority of the operation open next week, hopefully. On Monday, dental is going to take us a couple of weeks. We have some things that we're just trying to put some finishing touches on back there, so it may be 2 weeks before we get dental fully open. But starting on Monday, we'll be up and running everywhere else. The medical staff was, we've always had trouble stabilizing it, and just the complete lack of space and care has been inadequate. So really the funding that we're getting from Indian Health Service, the construction of the new facility, we're really going to focus in on trying to stabilize the medical staff so that our patients can see the same providers each and every time that they come. The expansion of dental, the expansion of pharmacy, the expansion of behavioral health is just so vital to the overall importance for our community. And I'm just so happy that Muscogee Creek Nation's the leader in providing that care here.